To Nina Wilson. Fishy fats are friends in pregnancy. Will you welcome Nina?
Imagine if I told you that 1 in 12 babies born in Australia are born too early, and that consuming fish during pregnancy could decrease the likelihood of your baby being born premature. Wouldn't you be eating fish too? So why fish? Well, seafood, particularly fatty fish, is high in a specific omega-3 fat that is important in the development of a baby's brain and vision during pregnancy, and has shown to reduce early preterm birth. But this omega-3 is only found in fish or fish oil supplements. So if we don't consume enough in our diet, our likelihood of having a preterm baby increases. Now, there are consequences of preterm birth, including complications and immaturity of the baby's brain, heart, and lungs. But despite the benefits, we think Australian women are consuming low amounts of omega-3 fats, meaning that some women may be entering pregnancy with depleted omega-3 levels. We're uncertain if women avoid fish even more during pregnancy because there is no current national data on omega-3 intakes in pregnant women. So to find out more, I interviewed 81 pregnant women in Adelaide who were not taking fish oil supplements and asked them about what they had eaten the previous day. I found that only 1 in 4 women were consuming enough omega-3 to meet recommendations for pregnancy, but this meant that the other 3 in 4 women were not meeting recommendations and were potentially increasing their chances of giving birth too early. Now, diet isn't the only factor that might affect omega-3 levels in pregnancy, and this is something we need to understand a lot better. By analysing previous studies, I found that there are some lifestyle and clinical factors that might be having an effect. So far, I've identified that omega-3 levels seem to increase from trimester 1 to trimester 3, and that the weight of the mother may play a role too. But we're not sure about the other factors just yet. Fortunately, I'm looking into that now, using data from over 5,000 pregnant women to pinpoint exactly which factors are having an effect. But since I've identified that omega-3 intakes are low in pregnancy, and that these levels may be lower in the first trimester, my next steps will be creating a specially developed, nutritious diet aimed at increasing omega-3 levels in early pregnancy and without the reliance on supplementation. By doing so, we hope to encourage all expecting mothers to have the best nutrition early on, with plenty of fish and dietary omega-3, so that we can help prevent the number of preterm babies born each year and make sure that all babies have the equally healthy start to life that they deserve. Thank you.